My name is Olivia Harlow, and this is my community health nursing presentation. My community is Morganton, North Carolina. We're a small rural community. We're located in the foothills of North Carolina at the Appalachian Mountains. We're surrounded by several larger cities: Charlotte, Asheville, Boone, and Winston-Salem. It's really beautiful scenery here. We have a lovely courthouse square. It stays busy year-round. Have lots of activities on the square. During the summer, they have concerts every Friday night for the community to enjoy. Lots of activities for the kids on those Friday nights. It's just a really nice community. Have everything that you could, offer there. It's just a really beautiful place to be. We are privileged in my community. We have multiple choices for emergent health care needs. We have multiple primary care providers that are easy to access in my community. There are many specialists in my community, and they maintain offices and ties with other more advanced hospitals in larger cities. So if you have specialty needs that can't be taken care of in our general hospital, you can go to the larger cities where they have ties to have those other needs taken care of. We have multiple parks and fields to play in. Many of our parks have splash pads during the summer for the kids to play in when it's hot. We have multiple walking parks. We have one that surrounds the Catawba River, and you can walk several miles around it. Many of the homes in my community have been established for quite some time. We have several historically preserved homes and communities. We have the community college in our community, and it serves as a transfer college as well. So you can get a 4-year degree in our community through Western Piedmont with the Lees McRae and Appalachian Community 4-year college. And I think there's several others that work with Western Piedmont now as well. People feel pretty safe in my community. It's not uncommon to see people walking their dogs or their children in strollers around the community. People seem to have no issues walking around uptown shopping. It's just generally a safe area. There are approximately 17,518 people in my community, according to the Census Bureau. We're predominantly white. Our Hispanic population is quickly growing. A large portion of our Hispanic population does migrate here to work at Case Farms, and that's where a lot of our manufacturing jobs go to there. And we have several other plants that make car parts in our community. We have several healthcare facilities. We have the state facilities that are located here for employment opportunities, as well as several other healthcare facilities. Heart disease continues to be our leading cause of death. It's also our state's leading cause of death, mortality. COVID-19 continues to be on the rise in my community, and now Charlotte is our next biggest city to us, and they have the monkeypox there, so we're all on the lookout for monkeypox getting to our community because it's really close. But there's a lot for us to be on the lookout here. We have been trying to keep COVID down because it is back in our hospitals. We do have hospitals with COVID in them in our community. And I know one of the state hospitals is going back to N95s. They're having to wear the N95s again. But that's just a little bit about our community. So with my project, I partnered with the local options victims, domestic violence victims organization. My primary liaison was Leslie, and I partnered with the executive director of Options, Christy, and the shelter manager, Julie, and the team lead for the ACT team, which is the Assertive Community Treatment team here in Morganton, Laura. Leslie, who was my primary liaison and the victims advocate at Options, she assisted me with finding lots of helpful information with the resource that I used, which was the National Coalition Against Domestic Violence, as well as a few other websites. She helped me meet with the other members of Options and gather all their resources, what they were offering to victims, what each person in the organization did, what resource they offered. She was very helpful with that. She helped me with the information that needed to go on the educational material that I created so people could see what the resources were that were available and how to contact them. And she was a big help. Christy, the executive director of Options, she gave her input as to how the brochure should look, as far as making sure that everything was in the right place, that it was appropriately documented, and all the statistics, were correct. Julie was helpful in the fact that she gave me a tour of the shelter. She linked me with one of the resources that I utilized. She gave me some information from some experiences that she had, which helped me create some of the tips that I used on my brochure to help people with ways to get away from somebody if they were in a situation. So she was a very beneficial partner. Laura, the team lead for the ACT team, she was very beneficial in helping me set up the educational session. She discussed with me on several occasions how this would be beneficial for them because their members cannot utilize therapy outside of their office and pay for it twice with Medicaid. So the therapy that they could receive at Options for free would benefit them. So we were excited to share this with her team, which it was a good thing. So that was beneficial. Laura was great. And my resources were the National Coalition Against Domestic Violence. They were the best resource. They had all of the statistics. They have statistics for every state listed. I used some other resources, but they were the main one. Emma was the photographer. She offered to take pictures of the shelter for me, for my board, to update the pictures because the board will be used for Options other times when they go out and go into the community. It will be used again. And there's pictures of the playroom, so it'll be more appealing for people to see that there's something there for their kids to do, and it's not just a bland shelter and somewhere that is dilapidated or whatever. There's something that's more appealing. It's not just some drab place for people to go. So it was helpful and beneficial for people to see that. And then Table Rock Printers was my other resource. They printed the brochures for me. So I had those to hand out, and then I printed extra for Options to have as well to give out into the community. To reach my nursing diagnosis, I realized there was a deficit in the mental health status. According to the statistics, over half of women who have mental health issues have been or are being abused. I confirmed with Leslie at Options that they were maintaining full status at the shelter. I have noticed myself when out in my community that there has been an increase in domestic disputes in public. After gathering information, I reached the diagnosis of risk for ineffective coping among the people of Burke County, related to domestic violence and or sexual assault as evidenced by shelters are full of victims. And as you can see, there are several statistics listed that I pulled from the website that I mentioned earlier. When I devised my community health plan, I tried to figure out what would be the best plan for me to figure out how to help my community and what I could actually assess. So I decided that I would have an educational session with the ACT team, and I would get them to verbalize the resources that were available in the community. I would have them verbalize the statistics about the domestic violence in the United States and North Carolina, and then see if they could tell me that how they could better assist the victims in our community by linking them to proper resources. For my long-term goals, I want to be able to, in 1 year, see that there will be an increase in the victims being linked with proper resources to reduce the amount of domestic violence occurring in the community, and that there will be more space available in our shelter related to a decrease in the domestic violence. So, I know I won't be able to assess the long-term goal for another year, but the short-term goals, I was able to assess those, and I will tell you about that in another slide. So this is one side of the brochure that I created, and the first part of my intervention for the ACT team was to provide them with a brochure, and we discussed the effects of domestic violence on mental health. And part of that is it increases substance abuse. It can cause PTSD. It can cause depression, anxiety. It can cause, with children, it may cause them to have issues in the future. It can cause angry outbursts, lots of issues on down the road for many people, and they last for a very long time. So it was very appropriate to choose the ACT team because it affects them a great deal with their line of work, because they do work with mental health patients. So that's why I chose them to have the educational session with. This is the second page of the brochure, and where we discuss the free resources that were available to the victims through options, and where we discuss some of the statistics. And you can see where the services are listed, where the crisis intervention, the safe shelter, case management, the education for the community, the support groups, and the individual therapy services that were so important to the ACT team. We went over everything in detail during the educational session. There's some more of the statistics that we went over listed on the pamphlet or the brochure. Some of the things to look for in their clients, or discuss with their clients about how to recognize abuse, that you may not realize you are being abused. Of course, the options, mission, and vision statements are on there. Just several things that we had discussed during the session, and we went over some more statistics, but this is just what was on the brochure. This is pictures of the trifold board that I completed for options. It has more in-depth statistics on it. I'm not sure if you can read all of them. It has also got the pictures of the shelter that I was talking about Emma taken. Several little things on there. The vision and mission statement for options. Again, this is a board that they will use. They will take it to them with them to fairs and festivals to share with the community about their resources in the future. So it will continue to be utilized for more than just this community project. This was viewed and discussed. They were able to look at the pictures. They were able to ask questions about the further statistics. It has all the staff. They're easy to access information. what their titles are. So if they need a specific, the court advocate or the therapist, who they might need in the particular service area, they're listed on the board. So you can get to the specific person that you need. So for the evaluation of the goals, I offered to answer any questions, process with them about the resources, what they had learned, their statistics, ask, what they had learned. If they needed any further resources, I made sure that they had their brochures, told them where they could get more, and made sure that they knew where the shelter was, if they needed to get someone there. Make sure they had all the contact information, knew where it was in the brochure. Had kind of a little quiz session to make sure that they had retained the information. They did meet their short-term goals. Like I said before, we were unable to assess the long-term goals. I returned in 1 year to assess the resources utilized with Leslie, to see if anybody had increased utilization as far as the therapy goes, if they've increased utilization of the court advocate. We'll return in a year and assess how the census is, if it's gone down, if they've had any more vacancies than they have in the past 2 years, or if the shelter still remains full all the time. So even though we're still a small hometown community, we still have our issues. Morganton is a very nice community. It still battles homelessness, domestic violence, mental health, and substance issues. We do have a multitude of resources. We just need to learn how to utilize those resources. I do thank Leslie and Laura for being such great resources and helping me with my project this semester. Leslie for being my liaison, and Laura for assisting me with getting the community project to the ACT team. I hope my plan for the reaching out to the community reduces the impact on domestic violence in my community, and it helps better utilize those resources. And I plan to go back in a year and see if that has been accomplished. So it's been a great semester. Thank you for your time.